Thank you, Paras. So I'm going to talk about the reconstructing ocular surface with amniotic membrane. I do not have any financial disclose. We may come across these various types of ocular surface disorders, and reasons are infection, inflammation, scarring, degeneration, loss of stem cell, thinning, maintenance, loss of stroma. And solution for these all different types of ocular surface disorders are varieties of grafts like conjunctival, corneal, scleral, stem cell, and amniotic membrane graft. They provide tectonic support, but everyone can't stop the ongoing infection and inflammation. So we require something which can stop this ongoing infection and inflammation, and amniotic membrane can does that by stimulating the reepithelialization. It has very good anti-cicatricial activity. It prevents the neovascularization. It has anti-inflammatory quality, and best part is there is no immunological rejection. And it has high tensile strength, so can be used for the larger surface area. And this work was published as an amniotic membrane transplantation and option for ocular surface disorders. The clinical uses of amniotic membrane can be in acute condition and chronic condition. Acute condition, Dr. Gautam Parmar is going to talk about in acute condition, AMT in chemical burns, so I am not going to present. This work was also published. Then in chronic conditions, it can work as to restore the corneal integrity in various types of corneal disorders, and we will see one by one. So this was cases with the spheroidal or band-shaped keratopathy, where you just scrap this pathology and put the amniotic membrane, and you can get the definite decrease in the corneal haze and improvement in the vision. So this work was also published. In cases with the refractive infectious keratitis, where corneal ulcer is not responding to the medical therapy, here also you can put the amniotic membrane, and because of its property, it helps in healing of such type of refractive corneal ulcers. The technique is very simple. You just take out the infected necrotic material, deepithelize the things, just put the amniotic membrane. Depending on the thinning of the cornea, you can put single layer or multiple layer. And you can see the results. There is absorption of the amniotic membrane, and it turns into the corneal opacity. Similar way, in cases with the corneal thinning, the technique is same, but at the place where there is thin cornea, you just put the multi-layer of amniotic membrane, fill that gap and suture it, or even you can put the glue over this, and above this multi-layer of the amniotic membrane, you can put a single sheet of the amniotic membrane, and you can see the good achievement in the good healing in the form of leukomatous corneal opacity. So these varieties of infectious keratitis was also published in different types of paper. This amniotic membrane also helps in the perforation, whether it is small perforation, moderate or severe type of perforation. Again, the technique is same. You just scrape out all the slough necrotic material, and you can put multi-layer amniotic membrane. You may glue it, or you can put the sutures over it. It is very simple, but you can see in this side pictures, there is a small perforation, membrane is in the place, and after healing you can achieve a good thickness of the cornea. So these are various cases of the perforation where amniotic membrane was used. So in this case, after complete healing, only cataract is there. If you operate the cataract, in such cases, the patient can regain the vision. Few more cases here also you can see there is good achievement of the corneal thickness also. So with amniotic membrane, it's not only the healing, but you can get the thickness. In big perforation, where you are not getting the donor corneal graft, and you can't let this patient like this, so you just put the amniotic membrane. It will definitely reduce the inflammation, but cannot give the tectonic support, and later on when you get the donor cornea, you can do the keratoplasty. So this various size of corneal perforations were also published in different types of the journals. In PUK also, this is very, very useful. You can go for the lamellar keratoplasty, but if you are not having the donor cornea, you can just do the proper dissection, take out the fibrosis and necrotic material. But in perforation or such type of thing, you take care that over the perforation, just remove this necrotic material in the end. so that you don't lose the anterior chamber depth. And then put the roll of the amniotic membrane, and you can see on the pictures there is good healing of the this PUK. This was also published. So slit I am not going to talk about. This was patient with chemical burn, and this was covered very well with the Paris. Few more cases with the stem cell slit in stem cell deficiencies. So amniotic membrane can be used as a ocular surface reconstruction in various types of ocular surface disorder. This was case in pterygium also. In recurrent pterygium you can use amniotic membrane, or even for the larger pterygium I do the mini ipsilateral slit, where you take out the pterygium and from the same eye you take the small lenticles of the stem cells, and then you can put the amniotic membrane, and over the amniotic membrane you can put these small lenticles of the stem cell over it, just like similar to the slit what we are doing, but you are doing it for the smaller. And in pterygium also, recurrent pterygium, you just take the pterygium out, put the amniotic membrane with the glue, and above that you can put the conjunctival limbal autograft, so that it double protection is there, so the chances of recurrence are very less in such cases. Symblepharon release or joita is already covered, so I am not going to cover, but in blind eyes also, where there is shortening of the fornix, symblepharon is there. This amniotic membrane can help you to reconstruct the fornix and can give the good prosthesis. So this work in blind patients also was published. In the end, I will just tell you one case with post small incision cataract surgery. There was surgically induced necrotizing scleritis. Sclera was very thin, and here also I put the roll of amniotic membrane, and this was healed completely. So with the help of amniotic membrane, you can treat the various types of ocular surface disorders of various etiology. Thank you. Anybody wants to any questions? I think we will take it in the end.
That was fantastic talk, Dr. Shreya. And you have covered almost all the aspects which comprehensive ophthalmologist would want to understand as far as amniotic membrane use